Carveda, Carvedilol, is a tablet formulation available in SQs of 3.125 milligrams, 6.25 milligrams, 12.5 milligrams, and 25 milligrams, marketed under the slogan Carveda Cares. Studies with references heart failure. Prevalence. Heart failure affects 64 million people worldwide. Improvement in LVEF. Carvedilol increases LVEF in hypertensive heart disease patients by 11%. Significant improvement in LVEF was shown in hypertensive heart disease patients. Re-hospitalization rates. Carvedilol significantly reduces re-hospitalization rates in CHF patients compared to bisoprolol. Hospitalization days. Reduction. Carvedilol is associated with 40% fewer hospitalization days for heart failure and 27% fewer days overall for other causes. ACC Guidelines. Recommendation. ACC Guidelines recommend Carvedilol as an evidence-based beta blocker for stage C HFrEF. Carvedilol is recommended by the ACC Guidelines 2024. Titration should continue even if symptoms improve or the patient appears stable. Copernicus Trial. Carvedilol demonstrated effectiveness in the Copernicus Trial. Copernicus Trial demonstrated the effectiveness of Carvedilol. Indications: chronic therapy of HFrEF, heart failure with reduced ejection fraction, hypertension, left ventricular dysfunction following myocardial infarction in clinically stable patients, chronic stable angina. Mode of action. Carvedilol is a non-selective adrenergic blocker that reduces heart rate and myocardial oxygen demand while improving left ventricular function and ejection fraction in patients with heart failure and hypertension. Features and benefits: evidence-based therapy, recommended as a first-line beta blocker therapy for stage C HFrEF. Improves LVEF, shows an 11% increase in hypertensive heart disease patients. Reduces re-hospitalization. Demonstrates significantly lower rates in CHF patients compared to bisoprolol. Reduced hospitalization days. There was a 40% reduction in heart failure-related days and 27% overall. Flexibility in dosage. Suitable for titration based on patient tolerance. Dose heart failure, starting dose. 3.125 milligrams BD, dose titration. Double every 2 weeks upon patient tolerance. Maximum recommended dose, mild to moderate HF. 85 kilograms, 50 milligrams BD, severe HF, 85 kilograms, 25 milligrams BD, left ventricular dysfunction. Following MI, starting dose, 3.125, 6.25 milligrams BD. Titration. Increase at 3 10-day intervals to 12.5 milligrams BD and target 25 milligrams BD. Maximum dose, 50 milligrams BD. Chronic stable angina, starting dose, 12.5 milligrams BD for the first 2 days. Maintenance dose, 25 milligrams BD. Maximum dose, 50 milligrams BD. References for studies mentioned. Study demonstrating improvement in LVEF in hypertensive heart disease patients. Study comparing re-hospitalization rates between Carvedilol and bisoprolol. ACC Guidelines 2024 recommendation of Carvedilol. Copernicus Trial results for Carvedilol efficacy. Marketing details. Carveda is a globally recognized beta blocker for cardiovascular conditions, including heart failure, hypertension, and MI recovery. Manufactured by Ferozsons Laboratories Limited, it offers key benefits like improved LVEF and reduced re-hospitalization rates. Its non-selective adrenergic blocking mechanism and evidence-based positioning, ACC Guidelines 2024, make it a preferred choice. Carveda's flexible dosing regimens cater to diverse patient profiles, targeting cardiologists, general physicians, and healthcare professionals in cardiovascular care.